So at ESMO this year, we are presenting a study where we compared two different dosages of Ipilimumab and Nivolumab in metastatic unresectable melanoma. So the background to this is that already in 2016, we started to use combination therapy with these drugs, and this was based on the positive findings from the CheckMate 067 study. But then in 2018, there was another study, CheckMate 511, that showed when flipping the doses, that is giving instead of 3 milligrams of Ipilimumab per kilogram, there was 1 milligram of Ipilimumab per kilogram. And this study, it showed that the traditional dose, had more immune-related side effects, and significantly more so. It also showed that looking at the efficacy and the survival, there were no significant differences. But since this study was not designed as a non-inferiority study, this dose was never approved by regulatory authorities. So in Sweden, we had concern regarding the toxicity from the traditional dose. So from this time point, 2018 and onwards, we implemented this dosage and has since been in free use for advanced unresectable melanoma. So from the regions of Stockholm and region of Gothenburg, we did a population-based study where we included all patients that had been treated with these with Ipilimumab and Nivolumab for this indication. And we included 399 patients, and the follow-up was 42 months. And 209 had the flip dose, and 199 had this traditional dose. And there were some baseline differences, such as those with traditional dose being somewhat younger and having more advanced disease. But when we adjusted for multiple factors, including the age of the patient, ECOG stage, and also the LDH, the disease stage, and numbers of sites of metastasis. We still found that both the overall survival and the progression-free survival was highly significant, with an HR of 0.59 for the progression-free survival and 0.67 for overall survival. And also when looking at different subgroups, we found actually that the flipped dose had better efficacy. And this was also true for those with more advanced disease, and also those with brain metastasis, and even those with more high burden disease in the CNS, and also symptomatic patients needing cortisone. And when we're looking at the side effects, like in this CheckMate 511 study, we found that significantly more immune-related side effects with the traditional dose, being more than 50% with the traditional and 30% with the flipped dose. And also when we saw how much treatment they had received, we saw it was significantly more patients that received all 4 courses of Ipilimumab and Nivolumab with the flipped dose, and also significantly more that started the maintenance Nivolumab therapy. And what are the reasons why we see this is even better outcome with the flip dose than in the CheckMate 511 study? Where also in this study they had 360 patients, and the median follow-up was 90 months. But of course, our study is a real-world. It's a retrospective study. Still, it's the largest real-world study looking at this. There hasn't been any study like this before, and here we leverage on that. Actually, in Sweden, we use this therapy more than I think you have been using in other countries. But we think that, for example, in CheckMate 511, we saw that those patients that had ECOG 1, patients with ECOG more than that were not included in this study, they actually seem to be benefiting from the flip dose. And in the real world, it could be that our patients, they are not as fit as in clinical trials. And in this setting, it could be better. And probably as the patients then are getting more treatment, more courses of therapy. But I think that at least if we see that this treatment is as good as with the traditional, that sparing the patients from all these side effects is definitely something that I think is supporting the usage, more broader usage of this treatment.